Hello, I'm Denise Drane, Senior Director for Research and Evaluation in the Searle Centre for Advancing Learning and Teaching and in the Office of Research in Higher Education, Training and Evaluation.
Hi, I'm Bennett Goldberg, Director of Research in Higher Education, Training, and Evaluation, and a Professor of Physics and Astronomy at Northwestern University. Welcome to the module on closing the feedback loop. In this video, an associated workshop for the third module of Training and Program Evaluation, we will describe the main structures and processes that lead to successful utilization of trainee data and feedback. The utilization that will then lead to efficient and effective cycles of improvement. Evaluation is a continuous cycle of goal setting, aligning activities, measuring their effectiveness, examining that data, prioritizing potential changes, and then making those changes to improve the activities for the benefit of your trainees. Here, our focus will be on the portion of the cycle where feedback and data are reviewed, where meaning is made, changes recommended, and improvements implemented.
Our first learning goal for this module is for you to identify what you should measure in your program and when you should make the measurements. This is always a balance of the depth of the information that you want to collect, the effort and time, both on your part and the part of their trainees, and will depend on your context. Our second goal is for you to be familiar with the strengths and weaknesses of different measurement methods so that you can use the method that's most appropriate for your context. Our third goal is for you to then develop the process for what you will do with the data and to determine who you will involve in that process. Finally, our fourth goal is for you to apply the same scholarly approach you do in your science to inform the changes you make in your program.
Let's start with what to measure and when. Since this is concerned with formative feedback, the things you want to know that tell you whether your activities are working and how, consider your program activities, especially those that impact trainee outcomes. These can be academic and research activities, as well as those you have that support the social and professional development of your trainees. Similarly, you may want to explore attitudes towards your program goals and potential concerns of your trainees, as well as how they feel about their engagement overall and how their attitudes, perspectives, and motivations align with those of your program.
Now let's explore when to measure. Information associated with program activity that's key should be measured annually, taking into account natural cycles of trainee turnover. When you implement a new activity or make a change based on prior data, you'll want to know if those new elements or changes are working. If you're able, try to collect some feedback early on when the changes are in the process of being implemented so that you can be nimble and make any modifications that are needed. Finally, you must always balance the burden that participating in evaluation places on trainees with your desire to explore the effectiveness of activities and program elements. So you need to consider how often you are asking trainees to participate in surveys and focus groups and the time commitment required for them.
We will now explore the strengths and weaknesses of surveys, focus groups, and individual interviews. These are the three classic and most likely means of gathering feedback from trainees. Beginning with surveys. They are efficient, inexpensive, and provide immediate analysis as they often yield quantitative data that come from trainee ratings and responses to questions that use scales. Note also that their potential anonymity may encourage more open and honest feedback since participants know that their comments cannot be associated with them individually. The downsides include the basic fact that the questions you ask are based on your understanding of the activity's impact, and may miss something unforeseen. Also, numerical scores can be difficult to interpret, and so may not lead to actionable changes.
Focus groups are often enjoyable for trainees and can also lead to emergent perspectives as participants build upon each other's ideas. Focus groups are also efficient as deep reflection among half a dozen trainees typically occurs during one session. They're also ideal for exploring program modifications. But because of the lack of anonymity, they're not good for sensitive topics like equity and inclusion or feedback on mentoring. Recognise that they do take more time in analysis as the evaluators do a thematic qualitative review to pull out key findings.
Lastly, individual interviews, for example, structured exit interviews, can support in-depth exploration with one-on-one dialogue, allowing you to access extensive and thorough feedback about an individual's experience in your program. Interviews are also great for examining sensitive issues, as long as the interview is not strongly associated with your program. Of course, individual interviews take a lot of time, as does their analysis. Shifting now to the issue of what to do with the data you collect and analyze. We want to make an important point here. There's abundant research and examples where change, real change, meaningful change, really required stakeholders and participants in the room. Complex social problems, including healthcare, education, and poverty, have really demonstrated over the past decade that to evolve these complex systems requires the involvement, buy-in, and agency of a range of stakeholders, participants, program leaders, and supporters. Involving all those affected by, delivering, creating, benefiting from, and responsible for success of your program will be a key to your overall success.
Evaluation that includes a role for participants in developing the evaluation plan and methods and/or interpreting the evaluation data is termed participatory evaluation. It's recognized as a valid and reliable form of evaluation that catalyzes change because it integrates program stakeholders into the process. First, identify all the program stakeholders. This will include trainees as well as institutional leaders, program administrators, and faculty mentors. Next, determine the role they will play in the evaluation. This might include giving feedback on evaluation methods, survey questions and focus group protocols, reviewing and interpreting data, and co-developing recommendations in response to the evaluation findings. Involving stakeholders in evaluation helps you to conduct more equitable evaluations because multiple voices are included in the evaluation design and analysis and in the formulation of recommendations.
The purpose of centering equity and inclusion in evaluation is to break down the traditional approaches to evaluation, where the evaluator is separate and independent, objective, so to speak, and they survey participants with questions typically developed by the program leadership. This approach tends to be narrow, exclusive, and biased, and it doesn't lead to equitable program outcomes. Equitable evaluation is based on 4 principles. First, consider yourself. What elements of your identity impact the way you are thinking about and doing evaluation? Next, as you build stakeholder groups, work to make them diverse, representing many lived experiences. That way, as Denise said, you ensure that diverse voices are not only in the room, but they are integrated into your process. And lastly, take an equity-framed lens to the work. Finally, when you're making changes to your program in response to evaluation data, take the same scholarly approach that you would take in your science. Look at the literature. There is substantial research literature to draw on, particularly in the areas of skills and competency development, mentoring, and professional development. You can use the literature as a guide or a starting point to make modifications according to the specific needs of your program and the context you are working in. In this way, you can make evidence-based changes to your program and maximize the probability of success.